Hello everyone, welcome to this session of Flashcard revision in forensic medicine and toxicology. My name is Dr.Jhanvi and I am the anesthesia educator on Unacademy, and today we are going to be discussing some important topics about forensic medicine. So I hope you guys are able to see me and hear me well. Please leave a thumbs up in the chat box if the streaming is okay, and we can go ahead with our class. Okay, yes, I can see that the streaming is absolutely fine. Alright, so today's class is basically going to be a quick revision of all the terms that are there in forensic medicine and toxicology. So in FMT, there are two parts. In fact, there are three parts. Okay, so the first part is the terms that they keep asking you questions about of forensic medicine. So like, what is a summon, what is a subpoena, what is a common witness, what is an expert witness, all of them. The second part that they ask you obviously is about toxicology. So all the different types of poisons, how do they look like, what are the antidotes, what are the symptoms that they produce. So we will be having a separate class on that too. And the third part is about your IPC sections. Okay, so IPC sections, I have taken a nice mnemonic video which is available on YouTube. You guys can watch it there. And of course, if you have any doubts about it, you can ask me on my Telegram ID, NEET PG with Dr. Jhanvi. Now, along with this, today we are going to be discussing some of the terms that are asked in FMT. Okay, so let's begin with our class for today. I am able to see your messages that you guys are typing, and I want this to be an interactive class. So welcome to Unacademy. The Plus subscription will give you daily live classes, live tests and quizzes, structured courses, and unlimited access using a single subscription. Then we have the Iconic subscription. The Iconic subscription is basically a joint venture between Unacademy and PrepLadder. So you will get the live classes and batch courses of Unacademy along with the video lectures and question bank of PrepLadder. This is the NEET PG 21 2-month calendar. We have a test and analysis batch for these 2 months, in which we will be covering all the 19 subjects, all the high yield important topics in them. And along with that, you will be having almost 12 grand tests till NEET PG. So if you guys want to join this batch, it is one of the best batches ever to be able to revise all your subjects, keep up with your schedule and plus test yourself, okay, by these grand tests. So you can buy this subscription, 2-month subscription, which is just for 6750 only. Along with that, when you use my code Dr. Jhanvi Live, you get a further 10% discount on your subscription. Okay, then we also have the ultra fast track high yield revision batch. We have offer on those wanting to buy an Unacademy subscription for 12 months, so you can get 12 months plus 2 months free. We have the Target Next 22 batch for next year students, professional year 4 batch for final year students, and we have the Focus FMG batch for December FMG students. This is the last month that we are running offer on the Iconic subscription. You can see that a 3-year Iconic subscription is available just for 58,500 rupees. We also have the 4-year subscription, Iconic subscription, for 75,000. So whichever subscription you would like to buy, don't forget to use my code Dr. Jhanvi Live, with which you will get 10% off on your subscription value. Alright, so let's begin with our class for today. Now the first question that I have for you guys is what is the difference between a common witness, a hearsay witness, and an expert witness? What is the difference between the three of them, between common witness, hearsay witness, and expert witness? And you can also give me any example of them. So you guys can write down in the chat box. I can see your answers in the chat box, whatever you think of, because this is a revision session. Flashcard session means we are going to be revising everything about FMT. So you should be knowing this. Very good, proud doctor. So expert witness is, yes. Alright, so proud doctor is saying expert witness is basically a doctor. So in other words, expert witness is someone who is an expert in his own subject. Okay, so it could be a doctor, it could also be any other professional. Suppose there is something about criminal case about someone copying someone's software. In that case, expert witness will be an engineer. Okay, So for many a times what we see encounter is that they have a forensic medicine person who will be the expert witness. He will be able to tell what is the poison, what is the sample that has been collected. If you have a surgeon at times, ki surgery has gone wrong, was this step done right or no, could anything else have saved the patient's life? So that is an expert witness. Okay. Alright. Now common witness is someone who is there at the site of crime. Okay. So he has to be present at the site of crime. So for example, you were walking down the road and you saw that there were two people fighting and one person hits the other person's head, or he bangs his head on a rock. So you will see that the person dies. So you are a common witness. Okay, here you are a common witness. Whatever you have seen, you will go and tell it in the court of law. So that is जो बोलते ना हमारे देखो देखा. Okay, so whatever you have seen, you are going to tell in the court. Okay, so you are present at the site of crime. And what is hearsay witness? So hearsay witness is not present at the site of crime. So now can anyone tell me whether hearsay witness is a valid witness or an invalid witness? So they often ask this in the exam. Is a hearsay witness a valid or a non-valid, invalid witness? Okay, so remember, a hearsay witness is an invalid witness. Why? Basically, if your hearsay witness is example of a neighbor, okay, so the neighbor says that I heard that the husband and the wife were fighting with each other and then the husband set the wife on fire. Okay, so she has heard about it, she has not seen it with her own eyes, so she is not a common witness, she is a hearsay witness. Okay, so your hearsay witness is an invalid witness. Alright, now after this, next we go to what is a cognizable offense. What is a cognizable offense? Any idea, guys? What is a cognizable offense? Alright, the definition of a cognizable offense says that you do not require a warrant for arresting the patient. Okay, sorry, for arresting the person. We often keep saying patient, patient all the time. Okay, so you do not require a warrant for arresting the person. Now, in cognizable offense, can you give me some examples? Now, they have to be heinous crimes. Okay, they have to be really bad crimes, heinous crimes. Ki you cannot even let the police come into it and say ki no, before arrest we need a warrant for it. Okay, so these are crimes that are unpardonable, and if the person is found guilty, definitely he will be spending many years in jail. So what are those kind of crimes, cognizable crimes? So first one is dowry death. You guys can also give examples. I am seeing your messages in the chat box. Yes, Faiz, Sadaf, all are saying murder. Absolutely correct. Murder is one crime. Proud Doctor is saying rape. Absolutely correct. Rape is another crime. Okay. Then robbery. After robbery, it is ragging. Okay. And after ragging, it is finally stalking. Okay. Stalking is also a non-cognizable offense. Okay. Alright. Now, after that, the next question that we have is, what is power of amnesty? Any idea about this, guys? I am going to write 2-3 terms because there is a little bit of a delay in the streaming. I am going to write the terms and you guys can till that time read the terms and start answering. Okay. So first the terms will happen. What is power of amnesty? What is mercy petition? And define a juvenile. Proud Doctor has given us the answer in Hindi, Saja Maafi, that's correct. But can you tell us exactly exam में क्या option आएगा that you will say that this is power of amnesty? Yes, you're correct, Proud Doctor. Okay. So if there is a death sentence, if someone is given a death sentence for rape, for murder, for bomb blast, okay, for any of that, so that death sentence can be cancelled. Now who is the person who has the ultimate power to cancel it? So it is the president of the country. Okay, so that is called as the power of amnesty. The power that the president has to cancel the death sentence or to cancel the punishment of the person is called as power of amnesty. Okay, now what is mercy petition? Mercy petition is basically this petition that is given by the criminal to the president. Okay, so he is saying that I know I have been held responsible for the crime and I am extremely sorry about it, but please do not hang me or please do not carry out this punishment. Okay, so power of amnesty means the death sentence is cancelled by the president, and mercy petition is basically that petition that the criminal is giving to the president that please cancel my punishment. Okay, juvenile definition is Fairs is not then less than 16 years. A juvenile is defined as anyone who is less than 18 years. Okay, always remember juveniles have lesser sentence as well as less intense sentence as compared to adults. Okay, so if they commit a crime in which usually an adult would have been in the jail for 5 years, a juvenile will be for 2 to 3 years. And they also have special juvenile homes, so they don't stay in jail, they stay in juvenile homes. Okay, alright. Now next important question which we keep asking repeatedly in the exam: what is the difference between police inquest and magistrate inquest? Difference between police inquest and magistrate inquest, if anyone can tell me this. Okay, so first thing that I want you guys from you is what is the criminal penal code for police inquest and what is the criminal penal code for magistrate inquest. The second point that I want is for whom do we do, for whom it is done. Okay, police inquest is done for whom and magistrate inquest is done for whom. And finally, who prepares the report in case of police inquest. So these are the 3 points that I need to know. Okay, very good, Gunjita. So police inquest is criminal penal code 174 and magistrate inquest, anyone can you tell me? Magistrate inquest is criminal penal code 176. Okay, now what are the things for which you carry out police inquest and for whom do you do magistrate inquest? Okay, so this is the easiest one. Police inquest is carried out for all unnatural deaths. Okay, so not for heart attack or accident, but unnatural deaths like suicide, poisoning, dowry death. Not dowry death, dowry death will come in magistrate inquest. Okay, so suicide, poisoning, all of these things, murder, all of these things are unnatural deaths. So in that you will have a police inquest. Now if the police is involved, if you feel that the police had some way of killing the person or had some involvement in the death of the person, then obviously you cannot tell the police to carry out the investigation, correct? So you need a separate body to carry out the investigation for this. So who will carry out the investigation? If you think that the police is involved in the death of the person, it is the magistrate. Okay, so what are the reasons or what are the places where you have magistrate inquest? So if you have deaths in police custody, if you feel that the police has beaten up the person and that's why he has died. Okay, if there is death during police firing. Next is if there is deaths in dowry related cases. Okay, so dowry death. Next is deaths in police investigation, any kind of investigation being carried out by the police and the person dies. Okay, or police interrogation rather. You all must have seen this many a times on movies, web series, everything. They have all these police interrogations in which the police hits the person a lot and they torture them a lot and that's why they end up dying. Okay, so that is if the person dies while during the interrogation, then the magistrate inquest is applicable for that. Okay, then last is exhumation. So if you want to remove a dead body for any samples, DNA sample or any bone sample, any checking like that to identify the person who is dead, So in that case, if you want to remove the body once it has been put into the ground, then in that case it is called as exhumation, and for exhumation you require special permission from the magistrate. Okay, all right. Now next question that I have, who prepares the report of police inquest? Okay, so the first thing is, what is the minimum level of inspector or the minimum level of police who will carry out the investigation? So the minimum level of police who will carry out the investigation is the sub-inspector. Okay, and the report that is prepared is called as the Panchnama. Okay, so these are the basic differences between police and magistrate inquest that you guys should definitely know for the exam. Okay, now other than police and magistrate inquest, we have one more kind of inquest, and that is called as a coroner's inquest. Okay, now is coroner's inquest applicable in India or no? And the next question that I have for you guys is, what is the best inquest system? So if you see between magistrate inquest, coroner's inquest and police inquest, the best inquest system is none of them. Okay, the best inquest system is the medical examiner's inquest. So the medical examiner will exactly be able to tell you where is the injury, what is the weapon, what is the mode of injury, how long has it been since the injury. So all those things best the medical examiner will be able to tell you. So that is why the best inquest system is the medical examiner inquest system, which we don't have in India. Okay, in India we have police inquest mostly. Okay, now coroner's inquest is used to happen during the British rule. So coroner was nothing but the crown official. What do you mean by crown official? Crown, yes, it is that series, crown wala series only. So crown official is basically someone who is a part of the team of the Queen of England. Okay, so during the British rule, they used to have the coroner carrying out the investigation, and obviously it was one-sided because the coroner used to always favor the Britishers. Okay, so that is called as the coroner's inquest. Alright. Now next question for you guys. Define important definitions. Define sapnya. What is sapnya? Second definition, what is ad testificandum? And third question, what is a plaintiff? Okay, so if you can answer any of these questions. And next we will be discussing the difference between dying deposition and dying declaration. That is another question that keeps coming in the exam again and again and again. Okay, so can anyone identify these terms for me? How will they come in the exam? They will ask you ad testificandum means, and they'll give you 4 options. It means expert witness testifies, common witness testifies, or the plaintiff testifies. Okay, so you should know the answer to this. Okay, so yes, sapnya, very easy, it is summon. So it is the letter that is sent to the witness to come and testify in court. Okay, so letter sent to witness to testify in court. Okay, they'll tell you this date you have to come and you have to testify. Alright, now what is ad testificandum? So ad testificandum is nothing but it is when the common witness testifies. Now who is a plaintiff? If they ask you who is a plaintiff, then plaintiff is the person who files the case. Okay, so suppose there is a person who is disputing my land. Okay, my father has given me a piece of land and someone else has created a house on that piece of land without asking me. So I am the plaintiff. I will file a case against that person. Okay, so I am the plaintiff. I am filing the case, and to call that person to court, a sapnya or a summon will be sent. Okay, so that is the sapnya or summon. So that is how you identify plaintiff and sapnya. Okay, alright. Now next we need. Now this one is like a super duper important topic in FMT, and this is the difference between dying deposition and dying declaration. is something that they keep asking every year in different forms. They will ask you hundreds of questions on this. So definitely this is something that you need to know. Okay. So what is the difference between dying deposition and dying declaration? Okay. So I'll write a few points. You have to tell me whether that is present or not present in each. So is the magistrate present in a dying deposition or in a dying declaration? Then second is, what about a cross examination? In deposition or in declaration, in which one you can cross examine and you can ask questions to the person who is almost dying. Okay. Then which one is valid in court, deposition or declaration? Finally, in which one do you take an oath? Okay. In which one do you have a examination of the person? And next is, are leading questions allowed or not? In which one do you have leading questions? Okay. So this is the main topics, and now you need to identify in which they are present and in which they are absent. Okay. So now remember, I'll give you an example of this. Like you have someone, you have a female who has been raped, and obviously she has been injured badly. So if she is in the hospital, and there are two situations. One is she's stable enough to talk. So in that case, they call the magistrate. Okay. They call the magistrate. There will be cross examination. They will ask her questions directly. Okay. So they'll ask her, where did it happen, how did it happen, what time did it happen, all of those things. So there will be cross examination. Whatever she says will be valid in court of law. It's not like she has to testify again in the court. Okay. She will take an oath before giving all of these answers, and that is the main reason why it is valid in court. Okay. Two main reasons why it's valid in court: because she is taking an oath, and also there is cross examination happening. Okay. She will willfully allowed to be examined in the hospital for collecting samples, for any kind of other leading investigation, and leading questions will be allowed in this case. Okay. So this is your dying deposition. Now when does dying declaration happen? Dying declaration is same patient, same person. She is in the hospital, she is raped, and she is injured badly, and she is almost on her deathbed. So she cannot even talk. Okay. So with great difficulty she'll say, I got raped by this person at this place. Okay. But at that time, patient is almost going to die. So it's not enough time to call the magistrate. There's not enough time to cross-examine her, or she does not have the strength to be cross-examined. Oath is not taken by the person. There is no medical examination, no physical examination of the person. There are no leading questions. Now, if all these things are there, there is no oath, there is no examination, there is no cross-questioning, obviously this will not be valid in court. Okay? So this will not be valid in court. But if this patient survives, at this time we are almost assuming that this patient is going to die within a few hours. Okay. If this patient survives, she will have to testify in court again. She will have to go in court and again give testimony of whatever has happened to her. Okay. So this is the difference between dying deposition and dying declaration. How will you remember this? Just say, if you are going to die, you will just declare, okay, मैं मरने वाली हूँ और whatever has happened to me is because of this person. So you are simply just declaring that he is the criminal. Okay. Because there is not enough time. So that is your main difference between dying deposition and dying declaration. Okay. Now, next question that we have. Few more terms for you guys to identify and tell me what it is. What is mens rea? Second one is, what is actus rea? And third one is, what is McNaughton's rule? What is mens rea, what is actus rea, and what is McNaughton's rule? Okay. So can you guys tell me either of them, whatever you all know? Okay. Alright. Mens rea basically means that there is criminal intention. Okay, what do you mean by there is criminal intention? So I want to kill someone who's coming to my house. So I invite the person to my house. I will take a bottle of water and I will make sharbat. I will add poison in it. Okay, so everything is premeditated, or everything is pre-planned. All your Ekta Kapoor serials, there is mens rea. Okay, there is an intention, there is a criminal intention in that case. Okay, what is actus rea? Actus rea is actually carrying out the act. It's basically committing the criminal act. Okay, that is your actus rea. So just having an intention may be one thing. I may have thought how I'm going to kill the person, but when he actually comes, I have cold feet and I don't perform the act. Okay, but if I end up committing the criminal act, if I end up giving him that sharbat which is full of poison, then that is called as actus rea. Okay, yes, absolutely correct. As Suman Kumar Ojha is saying, in murder both of these are present. You have mens rea plus you have actus rea. Okay, alright. Next we have McNaughton's rule. So what is McNaughton's rule? First of all, you should know which IPC section is McNaughton's rule. So McNaughton's rule belongs to section 84 of the IPC. Okay, so what do we say in McNaughton's rule? So we say that if an insane person is performing a criminal act, then he cannot be held responsible for it. Okay, of course there is also a exception to the rule. We'll come to that also. So McNaughton's rule says that if a criminal act is performed by an insane, then he cannot be held responsible for the act. Okay, so that is your McNaughton's rule. Okay, yes, absolutely correct, Rochelle Gonzalez. It is also simply known as the criminal responsibility of insane. Okay, can anyone tell me what is the exception to McNaughton's rule? When can the insane person also be held responsible? Any idea? Okay, there is one time which is called as lucid interval. Okay, usually we say insane people don't know what they are doing. Now what is the definition of insane? We are basically talking about people with psychiatric disorders, correct? So you have two categories. Either you have someone who's mentally retarded, of course they are not in charge of what they do. But if you have someone with a psychiatric disorder, for example, if you have bipolar disorder, okay, so in bipolar disorder, the person will be in two states, in mania or in depression. Okay, and they keep cycling between mania and depression. Now in between mania and depression, there is a normal phase also. Okay, so they are not always manic or always depressed. In between, sometimes they behave normally also. So this normal time, the time that they behave normally, it is called as a lucid interval. Okay, so this lucid interval, if crime is performed during lucid interval, so at this time the patient is normal, he can think straight, he has a criminal responsibility, he has mens rea, he has actus rea, then in that case you can hold him responsible for the crime. Okay, so he can be proven that the person was in lucid interval and he has carried out the crime, and you can always put him in jail because of that. Okay, alright, next two more things. What is compos mentis? I hope guys that the speed is okay, because I am just moving forward at one speed because I know that the streaming is a little slow. It's always there on YouTube. So by the time I start the next topic, then I start getting your answers on the previous topic. Okay, so what is the difference? What is compos mentis and what is testamentary capacity? Any idea? Yes, very good, Dilip Kondari. So compos mentis simply means patient is of sound mind. Okay? compos mentis means sound mind. Whatever he is carrying out, he is responsible for his actions. And what is testamentary capacity? So testamentary capacity basically means that the person is so much of sound mind that he can make a valid will. Okay, so the mental capacity to make a valid will, that is called as your testamentary capacity. Okay, and there is another term that comes, and that is holographic will. What is holographic will? So holographic will is nothing but if someone writes a will in his own handwriting. Okay, good evening Mohammad Atif Rose. Okay, so if someone is writing a will in his own handwriting, so he is leaving his sign, he is leaving his holograph. Okay, so will in his own handwriting is called as holographic will. Alright, now next we are going to move to some phobias. Another important question in the exam, they love asking this, so you should know some common types of phobias. Okay, so I'll write down all the phobias and then you guys can tell me what is the name of those phobias. So first one we have is fear of open spaces. Second one is fear of closed spaces. So whatever you all know, keep writing in the answers. Okay, third one is fear of heights. Super important because very common. Fourth one is fear of nights. I know that this is rhyming. So fear of heights, fear of nights. Okay. Fifth one is fear of water. And sixth one is fear of germs, which everyone has got during Corona. Okay. So tell me any of those fears that you know. Okay. Kiran has said claustrophobia is fear of closed spaces. Absolutely correct. So fear of closed spaces is called as claustrophobia. Good. Next, Suman Kumar Ojha is saying acrophobia. Yes, so that is fear of heights. Okay. Acros means height. So fear of heights is called as acrophobia. Good. Then Mohammad Atif Rose is saying that fear of open spaces is agoraphobia. Absolutely correct. It is agoraphobia. Okay, then we have Suman Kumar Ojha saying hydrophobia. Okay, yes, so I think that is self-explanatory. Fear of water is commonly called as hydrophobia. Alright, what is fear of nights and what is fear of germs? Anyone? Very easy. Try to think of the Latin words of all of these. Any idea? Okay, so fear of nights, night के लिए nyctophobia. Okay, that is your fear of nights, nyctophobia. And fear of germs, germs के लिए meso means germs. So fear of germs is mesophobia. Okay, so fear of open spaces, agoraphobia. Fear of closed spaces, claustrophobia. Fear of heights, acrophobia. Fear of nights, nyctophobia. Fear of water, hydrophobia. And fear of germs, mesophobia. These are the commonly asked phobias in the exam. Okay, now let's go to our next set of definitions. So define twilight state, that is our first one. Define honoroid state, that is our second one. Define somnambulism. And fourth is define post-traumatic automatism. चलो बताओ, tell me. What is twilight state, what is honoroid state, what is somnambulism, and what is post-traumatic automatism? Any one of them if you know. Many of us have been in twilight state, so definitely you all should know that. Okay, so I'll start giving you the answers because no one is replying. Guys, reply on the chat box. Okay, so basically twilight state is state of clouded consciousness. I'll give you the examples also along with this. Okay, twilight state is state of clouded consciousness. It may be boring, but it will come in the exam and then you will not remember. In which patient carries out irrational act, okay, or in which person carries out irrational act. So what do you mean by that? So basically, if someone is high, if someone has had drugs, if someone has had a lot of alcohol and he's in that high state and he beats someone up and he beats someone so badly that the person dies, so he's committed murder, but he was not in the right state of mind. He was in a state of clouded consciousness because of the drugs or alcohol, and that's why that is called as a twilight state. Okay, Suman Kumar Oja has said sleepwalking or somnambulism. Absolutely correct. So somnambulism is also called as sleepwalking. Okay, next, what is honoroid state? If we have twilight state already, what is honoroid state? So honoroid state is also similar. It is also a dream-like state. So you had state of clouded consciousness, correct? So honoroid state is a dream-like state in which patient is having hallucinations. So imagine you are having visual hallucinations that the person sitting in front of you has grown 3 heads and he's coming to attack you. What will you do? Immediately you will take something and you will attack that person. Okay, when that is just a hallucination, but you will end up attacking that person and you may end up killing that person. So you were in an honoroid state when that happened. Okay, and finally, what is post-traumatic automatism? Okay, so post-traumatic automatism is nothing but post-traumatic amnesia. So for example, if the husband has set the wife on fire, okay, if he has set her on fire for dowry, so the wife will be, for example, she has burns and she survives. So in that case, the wife may not remember any of the events that have happened, that my husband, he put kerosene on me, then he burnt me. So why has all that happened? Because of post-traumatic amnesia. She has been in such a state of trauma that she's completely forgotten memory of the entire event. So that is called as post-traumatic amnesia or post-traumatic automatism. Okay, alright, so now let's move on to our next set of definitions. Again, super important. All the super important ones I'll mark with star. Okay, what is the difference between superfetation and superfecundation? Again, something that they keep asking in the exam again and again, because they know that people get confused between the terms. So I'll write down what are the components and you can tell me. So what are the number of ova in superfetation and superfecundation? One thing we all know, that there are 2 children being born, okay, 2 fetuses being produced in both superfetation and superfecundation. Okay, so what are the number of ova? What are the number of acts of coitus? And what are the number of menstrual cycles that it happens in? Okay, so any idea about this? Come on guys, wake up. It's not so late in the night. If I can stay awake, definitely you all can stay awake. I have also woken up at 6 o'clock in the morning. Okay, so in both you have 2 ova. Obviously you have to have 2 ova if you want 2 fetuses. Okay, so in superfetation plus superfecundation you have 2 ova. Okay, in both you will have 2 acts of coitus. Obviously you want the sperms twice, okay, So again you have 2 ova and you have 2 sperms coming in. Okay, so both of these sperms are coming in 2 acts of coitus. Okay, now you need to know whether these two ova are produced in one cycle or they are produced in 2 different cycles. Okay, so in superfetation you have one ova in one cycle and second ova in the second cycle. Okay, and then the sperms will go to them. While on the other hand, in superfecundation, just remember this as an image based picture. Okay, in superfecundation you are having 2 ova and both of them are produced in the same cycle. Okay, and they are also fertilized by 2 different sperms. Okay, so this is your main difference between superfetation and superfecundation. Okay, so in the same cycle, if you are having 2 fetuses, it is superfecundation, and in different cycles, in cycle number 1 and cycle number 2, you are having 2 fetuses, then that is called as superfetation. Okay, alright, next let's move on to another few set of definitions. What is honeymoon impotence? First is that what is honeymoon impotence. Second is what is pseudocyesis. And third is what is fecundation ab extra. Tell me the meaning of all of these terms. If you all are revising FMT, you all should know all these terms because they will simply just mention the term and they will expect you to know the answers to them. Okay. Okay. So honeymoon impotence, I think it's very easy from the name, especially happens in arranged marriages. Okay. So it is any kind of anxiety to perform sexual acts due to fear. Okay, to perform coitus or to perform sexual acts due to fear. Okay, so that is called as honeymoon impotence. Alright, phantom pregnancy, yes. So phantom pregnancy is pseudocyesis. So basically the patient will not be pregnant. Okay, if you check her HCG levels and everything, they will be normal, so she will not be pregnant, but symptoms of pregnancy will be there. So every day in the morning she will say I am having morning sickness. Every day she will be saying that I have cravings for sour food, or she will say that I feel like my belly is coming out. Okay, so all of these things are symptoms of pregnancy, but when you go to do pregnancy tests, when you go to do HCG levels, if you go to do USG, there will be no signs of pregnancy. Okay, so this is called as pseudocyesis or false pregnancy. Okay, if someone has not read well in his past subject and now he is in 3rd year, what to do now and how should he start? Okay, Piyush, I will come to your question, but first we will finish our revision. Okay, so fecundation ab extra. What is fecundation ab extra? Any idea, guys? While you all are answering that question, I will ask Piyush's question. I will answer Piyush's question. So Piyush, it's not too late if you're in 3rd year. In fact, I think first 2 years of MBBS everyone enjoys. Even I have enjoyed my first 2 years of MBBS. So it's absolutely okay. Start reading your 3rd year subjects from your textbook as well as from your MCQ books right now, and join a course which gives you a complete comprehensive review of the subject. Okay, don't go for the rapid courses now or ultra fast revision courses. We have comprehensive courses also for the next 2022 batch, so you can go for those ones. In that the subject will be covered in detail, and along with that, since 3rd year subjects are a little easy, like your ENT ophthal, if you're in 3rd minor, that is, you have time to also start revising from those batches itself your 1st and 2nd year subjects. Okay, alright. Yes, Sucharita Chahu and Dilip Kondari have mentioned it correctly. What is fecundation ab extra? So if sperm is deposited on the thigh, okay, or if sperm is deposited on the vulva, or it is deposited basically not in the vagina but very far away from the vagina and the cervix, but still despite this there is pregnancy. Okay, now I know that is very hard to believe, but it is possible. The sperm can travel up, and this is called as fecundation ab extra. Okay, so you are depositing the sperm extra or in an area outside the vagina and the cervix, but still the sperm is able to travel up from there and carry out a pregnancy. Okay, so that is called as fecundation ab extra. Okay, next one, next few terms for you guys. What is supposititious child? What is a supposititious child? Okay, that is the first term. And then I want to know from you guys some common abortifacients, because this they ask in the exam. There are older, newer abortifacients that are commonly asked in the exam, so you should definitely know all of them. So tell me the definition of a supposititious child, and meanwhile I will give you two types of drugs acting as abortifacients by increasing uterine contractility, and second is drugs which act as abortifacients by increasing the menstrual blood flow. Okay, any idea? Okay, so what is a supposititious child? Supposititious child is nothing but a fictitious child. Again, full Bollywood style. So you say that अरे मैं तुम्हारे बच्चे की माँ बनने वाली हूँ, or you just get the child and say that this is your child. I think there was a movie also a few years ago, Salman Khan ka, in which someone sends the child, Salman Khan and Twinkle Khanna. So they say that this is your child. Okay, so they use a fictitious child for blackmail, to get money, to blackmail for power, property, everything. Okay, so fictitious child that is used for blackmail is called as a supposititious child. Okay, now some example of abortifacients. Anyone can tell me? Okay, so there are certain examples like ergot alkaloids and quinine. What do? They increase the uterine contractility. So if they increase the uterine contractility, the fetus will be immediately ejected out of the uterus, so there will be abortion. Okay, so ergot alkaloids and quinine. The second is the drugs that can cause increase in menstrual blood flow. Okay, so they can also act as abortifacients. So for example, your estrogen, then lead. Okay, so all of these can be used as abortifacients. Now what do they ask in the exam? So they ask about a lead product. What is the name of the lead product that is used as an abortifacient? So the name of that is diaclone. Okay, and second is, what is a potassium iodide paste that is used as an abortifacient? So potassium iodide paste used as an abortifacient is called as utus paste. Okay, utus paste. Alright, now next question. Again another super duper important topic about sexual offences. Now it's become even more important because of everything that's happening in the world. Okay, so sexual offences they ask for nearly every alternate exam. So I will be again posting some definitions and you will tell me what are those. What is incest? What is sexual relationship between mother and son called? Okay, then what is sexual relationship between father plus daughter called? What is sexual relationship between sister plus brother called? Okay, 1, 2, 3, 4. As I'm writing the definitions, you guys keep on answering. Okay, then define statutory rape and also define adultery. Okay, so if you can answer any of them, write down in the chat box. So I think we'll start off with the easiest one. Everyone knows what is incest. What is incest? Any kind of sexual relationship between family members, that is called as incest. Okay, sexual relationship between family members. Next is sexual relationship between mother and son. What is it called? Very good, Suman Kumar Oja. So that is called as Oedipus complex. sexual relationship between mother and son is called as Oedipus complex. Next we have sexual relationship between father and daughter. Okay, so I think Suman Kumar Oja has only mentioned it correctly. So that is called as Electra complex. Next we have sexual relationships between sister and brother. Okay, so that is called as, I think someone, Kiran John has mentioned it. So this is Pharaoh complex. Pharaoh complex. Okay, important things to remember: mother plus son, Oedipus; father plus daughter, Electra; sister plus brother, Pharaoh. Okay, what is statutory rape? So statutory rape is basically having sex with anyone who is less than 18 years. Okay, now what is the important thing about statutory rape? That even if you have consent of the person, that you are having a consensual sex, okay, still if the female is a minor, if she is less than 18 years, she could even be your wife, but she is not in the legal age of getting married. Okay, so even if it's consensual sex but the person is less than 18 years of age, then it is called as statutory rape. Okay, yes. And what is adultery? Again, very easy thing to remember. Adultery is nothing but extramarital affair. Okay, alright, moving on to our next set of questions. Okay, now tell me examples of indecent assault. When you say indecent assault, they can give you 4 options and ask you which of these is an indecent assault of females. So give me 4 examples of indecent assault of females, and before that also tell me there is a stain that is used for examining vaginal cells. Okay, stain that is used for examining vaginal cells, and what is the name of that stain? 2 stains in fact, not just 1 stain. Sucharita, written consent, if even if less than 18 years, written consent, oral verbal consent, nothing is valid. Okay, alright. So stain that is used for examining vaginal cells, there are 2 stains. You have Lugol's iodine. Often it is used whenever there are rape victims, so if you want to check whether there are vaginal cells present. Okay, so one is Lugol's iodine and the second one is Papanicolaou's stain. Okay, so remember the stains used for vaginal cells is Lugol's and Papanicolaou's stain. Next is, what is example of indecent assault of females? So I'm not liking it that you guys are not participating at all. You're supposed to know all this, you're supposed to tell me all this, because it's a flashcard revision of FMT. It seems like only a one-way lecture for me. Okay, so if you're stalking a female, following her, okay, voyeurism, if you're watching her change, bathe, all of those things. Okay, then sexual harassment often happens in public places, touching inappropriately in offices. Okay, so that is sexual harassment. And undressing a female, undressing or disrobing a female, all these are indecent assault of females. Okay, yes, so all these are examples of indecent assault of females. Okay, now next question. Again, identify the terms. What is vitriolage? That is our first term. Second is, what is POXO Act? I just want the full form of POXO. You should know the full form of POXO, very very important. POXO Act. Okay, next definition that we have is lesbianism. Next definition that we have is sodomy. All these they ask in the exams, guys. Okay, what is vitriolage? Vitriolage is nothing but acid attack. Okay, vitriolage is acid attack. What is POXO Act? So POXO ka full form is Protection of Children from Sexual Offences. Okay, so if you see POCO, PCSO, Protection of Children from Sexual Offences. Okay, so that is your POCSO Act. Okay, what is lesbianism? Lesbianism, it is also called as tribadism. Tribadism. So what is this? This is a sexual relationship between two females. Now what is the question that they can ask in this? Okay, so they will ask you, what is the active partner called as, and what is the passive partner called as? Usually the active partner has sort of male features and the passive partner will have female features. Okay, so the active partner is called as butch or dyke, and the passive partner is called as femme. Okay, femme means female only, so they mostly act like females. Okay, so this is your lesbianism or tribadism. What is sodomy? Sodomy is nothing but anal sexual intercourse. Okay, again unnatural act, so this is called as sodomy, anal sexual intercourse. Okay, now next question that we have is, if you have anal sexual intercourse between adult and child, what is it called? Okay, what is it called? Second question that I have for you guys is, what is sin of gonorrhea? What is sin of gonorrhea? Next question I have is, what is bestiality? And next question I have is, what is lust murder? So answer all of them. I'm just writing these terms and you guys are not answering at all. I'm not liking it because this is supposed to be an interactive session, guys. Come on, all of this you all have already read in FMT. You should be knowing the answers to all of them. And when you revise for the exams, you just need to go through all of these terms again. Already you have discussed these terms with me, so it's going to become very, very easy. Okay, Kiran John is saying buccal coitus. Absolutely correct. So sin of gonorrhea is nothing but oral sexual intercourse, or it is also called as buccal coitus. Okay, intercourse with beast, bestiality. Okay, not intercourse with beast, but Avinash Reddy is correct. It is intercourse with animals. Okay, so sexual intercourse with animals is called as bestiality. Again, unnatural sexual act. Okay. Okay. Now, can anyone tell me what is anal sexual intercourse between adult and child called? Any idea? Anal sexual intercourse between adult and child, what is it called? Okay, so this important, I think you guys have forgotten, it is called as pederasty. Okay, now in this, the adult who is performing the sexual intercourse is called as a pederast, and the child on whom the sexual intercourse is being performed is called as a catamite. Okay, this question is important. Catamite, it has come in the exam many times. Alright, last but not the least is lust murder. Okay, so what is lust murder? So if you kill the person after sexual intercourse, killing person after sexual intercourse, this is called as lust murder. Okay, alright, now next, and this is our last set of terms for today. So what is Bobbitt syndrome? That is the first question. The second question is, what is eonism or transvestism? And the third term is, what is voyeurism? And what are the other names for voyeurism? Chalo, batao. What is Bobbitt syndrome? Very traumatic. Okay, so Bobbitt syndrome is if you cut the male genitalia, that is the penis, after sexual intercourse. So that is called as your Bobbitt syndrome. Okay. Yes, absolutely correct. Cutting of genitalia after sexual intercourse. Okay, and specifically the male genitalia. What is eonism or transvestism? Eonism or transvestism is nothing but wearing clothes of the opposite sex. Okay, so you must have seen females wear clothes looking like a man, men wear clothes looking like a female. Okay, so if you are wearing clothes of the opposite sex, this is called as eonism or transvestism. And last we have voyeurism. Voyeurism is nothing but peeping Tom, watching other people perform acts of coitus, or watching other people bathe, watching other people getting undressed. Okay, all that is called as voyeurism. Voyeurism is also simply called as peeping Tom, and there is also another term for voyeurism, and that is scotophilia. Scotophilia. Okay. Yes, absolutely correct. So that's it for today, guys. We have discussed a lot of terms in FMT. In FMT, I told you in the beginning only, there are 3 kinds of questions that come. One is about these terms, so we have revised all these terms. Okay, second is you have to know the IPCs, so we'll do that in the next session. And third is you have to know the toxicology part, so again we'll do that in one session. Okay, so I hope that this class was useful to you guys. Thank you for joining me today. Please don't forget to leave a thumbs up at the end of the class if you liked it. We are going to be having a class at 10 p.m. every day on YouTube. Tomorrow's lecture is on image based questions in short subjects part 1. Okay, so don't forget, if you guys want, the links of all these classes, I am posting them